I decided I was going to tie off this tumor because otherwise I was going to do an operation on that. Tied off this tumor. Within a couple days the tumor started shrinking down, and when I say a tumor, this could be a granuloma, this could be a salivary. It was incredibly vasculated. It's actually, he's getting some size. Oh, look at that.
Yeah, he just bit
He's
my
animating. All right, to make him let go, we have to support his body. So he's gonna keep doing this because he feels like he's under attack. So walk towards me. We're gonna get his body onto the table. Alright guys, so we're going to show a video dealing with a leucistic boa constrictor. That's Constrictor imperator. It's my friend's animal, but he had some problems with it and he felt like it was going to die, and it certainly was. So I ended up meeting with him, getting the animal because he lives far away in Pennsylvania. I got the animal and I was like, wow, it was like pretty horrific. And quite quickly it became more horrific. And so I immediately started treating it. So you'll see our initial video where we're treating it. And this is the kind of thing where like I just filmed it to have it, and Donny decided we're just going to publish it. If the animal dies or not, you know, whatever, but kind of like a learning experience. So there was a good chance, 50-50, that I'd say that animal's going to die. I really was kind of like not in a comfortable place because he had this growth in the mouth and it was growing really, really fast. It had a big infection going on. It was gurgling. So we had like a bit of a respiratory in there, which is very common. You can have one bacterial challenge and then it manifests itself by a respiratory infection as well as a localized infection in the mouth. We had a lot of cellulitis, which is the tissue is all super swelling up with fluid, drooling, and all these different things. So I put on antibiotics, I gave it fluid therapy, I did things like that, and I was managing the thing. And ultimately what I did, I decided I was going to tie off this tumor because otherwise I was going to do an operation on that, and I decided I'm going to try to tie it off. So once I kind of got the infection under control, and I felt like the immune response was occurring. So just when I give them antibiotics does not mean that there's an immune response. So I need to use the immune system in conjunction with an antibiotic that has an effect on whatever that bacteria that's causing huge problems and challenges for that animal. So I was lucky enough, I used gentamicin, which is an immunoglide, very broad spectrum. It's an older type antibiotic that's not used as so much nowadays, so there's a good likelihood that it has a very broad spectrum of gram-negative bacterial response. So I did that, tied off this tumor. Within a couple days the tumor started shrinking down, and when I say a tumor, this could be almost like a granuloma. This could be a salivary type granuloma. It was incredibly vasculated. I think this has something to do with the salivary glands. So what we did is when the animal was first suffering problems, its lower mandible, it was almost like beginning something called cephalic mandibular cellulitis, where the lower mandible into the neck really becomes engaged with massive cellulitis. Everything swells up, blood flow becomes constricted, so you put it on a systemic antibiotic and you get it treatment throughout the body. A lot of times it's really hard to get like the antibacterial agent that you're using to get it in there and start dealing with all the bacteria. So it's a really a problem. This originally occurred from a rabbit. And I've seen in the past, you know...
When you say rabbit, what do you mean by that?
Okay, excuse me. Okay, it was a defrosted rabbit. I love bunnies too. But it was a defrosted rabbit. My friend gets them from a guy. They're like meat rabbits, I guess. So I don't know what happened because we have an outside injury as well as this inside. But I think it's quite likely that the rabbits tend to have these really sharp claws, and one of them punctured. And then we get something called Pseudomonas vulgaris. Pseudomonas vulgaris is often associated with rabbits, and it can give these horrific oral type infections, which is mandibular cellulitis, and it's really horrific, and it can be incredibly terminal. So in this case, I tied off this growth, 5, 6, 7 days later, I did a video with my cell phone, and the tumor, or whatever it is, falls off, and I was ecstatic because the base had constricted itself a fair bit. There was a lot of vascularization, because if I did actually a surgery, first of all, I don't have the desire to actually knock these animals out with isoflurane gas, because then once you have to intubate them with, you know, oxygen atmosphere, and then respirate them, and then put them on a Doppler, watch the heart. You know, I don't want to do any of that. Generally what I like to do is I like to use a localized anesthesia and just a numbing agent, which happens to be lidocaine. But so I've tied this thing off, the thing fell off, I've continued to treat it with antibiotics, I've been cleaning it, the animal's gone into its shed, and I'm really kind of, so far I'm really impressed. The gurgling has stopped. The nasty sore that was to the left of its glottis has really started healing. There's not a lot of necrotic activity going on in the mouth. There's a little bit limited where that, maybe it's a salivary gland. You know, remember, this is not an exact science, and I'm certainly not a vet. I just have a lot of experience, and I'm able to take all that critical information from dealing with lots of different things and put it together. Once again, empirical data. I was saying anecdotal, but people corrected me. There was some, you know, negative things, you know, people saying you need to get it tested and stuff like that. Well, we're going to see it's removed. It's not just magically growing back. Let's take a look where she's at right now. So our girl is in a shed. So shed is part of the healing process. Very, very critical. So when you have animals that are suffering an injury or they're sick, this animal suffered a massive bacterial infection that became systemic. You can still see a little bit of bruising. And what this is what happens. A white snake shows a lot what's going on. And you can see where blood vessels are really dilated. She's really battling something. So things are kind of like aggravated. So she's been on systemic antibiotics, which means that I give an injection intramuscularly, and then that antibacterial agent then is taken into the blood, and it goes all through her system. Her kidneys, which are down here, are the blood filter, which actually will extract that. And I'm treating her with gentamicin, which is aminoglide, and it also has a strong effect on the renal system, which means if the animal's in any state of dehydration, it can be very taxing and damaging to kidneys. So you always want to make sure that she is well hydrated. How to see if an animal is well hydrated? A snake. I'm going to pinch it. See that right there? So that quickly pulls back to normal. So that means that there is an amount of fluid that's present in the tissue, the muscles and all that, which means things are good. So that's a really quick thing. Let's take a look inside her mouth. Like I said, she is shedding. So this is probably not the greatest time. So we have multiple different things. We have this injury, which has now been, there's a lot of scarring, this fibrous material around here. I don't know what this injury is. This is my friend's snake. So that's one thing. So this is the lower mandible, and you have this hard area. Looks like we have the little point right here where it's scabbed. This was secondary to the real problem where we had this massive growth. And I'd probably say that it was probably something to do with the salivary glands. I just want to show you. So I removed the tumor type growth. So one thing that's really good, if you look at a lot of the gums, there's not a lot of petechia. So we're going back towards like a white kind of gum. So she still has, you know, a bacterial challenge, but let's see. I don't know if your lighting is good enough to see this.
It's not, but yeah, I can see it.
Okay, so this is where my growth was coming from. So right there, that's necrotic material. So necrotic material means it's basically bacteria and dead tissue, and we want to remove that because that actually becomes fodder for more bacteria and such. So you're watching her behavior, a lot of tongue flicking. You know, it was really great when I actually moved the tumor. All of a sudden, there was a lot of tongue flicking, like almost like she was excited to have this thing gone. I tend to try to be very passive when I'm dealing with an animal like this. I don't want to put this animal into a state of duress and panic. So when I am holding him behind the head, it's more like just the minimal. I just obviously need to control her. But what I've been doing is I've been cleaning her mouth. Let me show you. So if I go like this, so I'm kind of passive with my hand behind. And you can still see the spittle in there. So her glottis had a big nasty sore to the left of her glottis. So the glottis is her breathing tube. You can still see there's some damage. Some of the tissue has been destroyed. So it's closed right now. But when that opens again, so we're just gonna, so a little bit of bleeding is okay. It really, so you got here's a tooth.
What are you doing?
I want to get this tooth out. So we just have, okay, so actually, so look at this. So sometimes when you get a lot of oral trauma, her tooth just came out. So that's her tooth.
So was it just sitting there causing problems?
So what's going to happen is, so she's had a lot of trauma to her mouth, okay? So we have opportunistic bacteria. We got some of this stuff right here. This is all very much part of the course. And we're keeping the mouth clean. So what I do, just by me monkeying with her mouth, you'll notice that some of the blood vessels have dilated, so you get this like angry pink looking area. So the final thing I'm going to do right now, about twice a day, I go in here and I clean up her mouth. And
using what, Kevin? What is this?
So this is a very dilute betadine. So basically what it is, it's allowing me, I go in there and I just try to remove, so we call this like removing dying tissue and material. We call that like debriding. This might be a salivary gland right here, and you see one enlarged right here. So she looks a bit worse for wear right now by me just monkeying with her mouth, and I'm sure that's really uncomfortable. Hi. But I still haven't lost, you know, some relationship with her, because I think she realizes that I'm trying to help. She's in a much better state. So what I really expect is when she sheds, you're really gonna start seeing some clarity to like, was I successful from where it was to then treating it? It's been a few weeks now. I removed the tumor, or whatever you wanna call it. And you know, we can talk about what kind of cyst we think it is, but it's to me, it's just a, you know, it's a large, very vasculated growth. I mean, it got really big when in the video where I actually get it to come out. It had shrunk down quite a bit, but it got huge to the point where we weren't even filming it, because it was almost like my own private bad event. It was just, I wasn't enjoying it, because I really thought there was a good chance she was gonna die. You're gonna act crazy. Okay, come here.
Oh boy.
Oh yeah, he's got bad genetics. I'm gonna go in there. Let me go in there. Let me slow it down for a sec. I'm just gonna give him a chance to see just the table touching him.
Yeah.
See how he reacts to it. But you remember, this guy's had a horrible, horrible surgery. He's getting some size. Oh, look at that.
Oh my.
You know, he just bit
He's
my microphone.
envenomating.
Hold on. I should give way here in a second. Wow.
Jay, where's your phone?
Yeah.
Upstairs.
Yeah. Look at that. He means business. Get it on.
Wow.
Lucifer means business. All right, to make him let go, we have to support his body.
Mm-hmm.
So he's gonna keep doing this because he feels like he's under attack. So walk towards me. We're gonna get his body onto the table.
Okay, ready?
And at this point, he now thinks, when he decides to, his fangs are in there pretty good. Well, he hasn't tried to actually get off it yet.
DJ Muller's.
I'm not.
Oh,
Here we go.
What?
hold on. Keep the camera. Just kind
There you
of
go.
back. I gotta use both hands.
Yeah. You see that?
I can see face.
There's a little bit of danger. So this is for you. You performed a surgery on me, and you're gonna die. But he hates the microphone. Steve Martin said he hates these cans. In what movie?
I don't know. It's
Okay, that's the trivia, guys. He hates these cans. Well, he hates this mic cover.
You should know that.
walking up the whole damn thing.
Yeah.
God damn, that's a lot of venom.
Yeah. Are you okay? He's about ready to let go.
Yeah, back up 2 more.
Well.
Not ready to let go yet.
I know we can.
That's he's the savage.
Now if I pull it, it'll come. Hold on. Usually it comes out. It's getting stuck in the acrylic.
Wow. He really is committed to murder.
Alright, so what I can do, Kevin?
You can put it down on the floor if you.
I know I can get. Let this microphone go, and on top of the table here, it's gonna go loose. Ready? So I'm gonna go back towards you. Sorry, everybody, we did a mic change.
Some technical difficulties there.
Is that the Venom mic now?
Dude,
Venom series.
yeah, it's soaked in venom. What is that in your hand, Kevin?
This is a water moccasin. This is Tabitha. Hi, sweetie. I just don't want her to get her to panic.
Okay.
I don't want to be too stupid. I'm gonna readjust because she's not gonna like this surface.
I'm not gonna move.
I love water moccasins. They get such a bad rap. When in fact, they're pretty damn cool.
Where are they indigenous to, Kevin?
These are going to be in tropical. Well, actually, this is so we're in anything. I think they occur Virginia and south down the East Coast, and then as we start, going inland.
Have you heard people up here say there's water moccasins?
Well, so this is the problem. We're getting people confused with banded northern water snakes. So there's no water moccasins here at all. We actually had a guy here the other day from Texas, and who kept venomous, and he somehow thought that we had water moccasins in New Hampshire. But the problem is, it's bad enough you go out there and you find a water moccasin and you kill it because you're afraid of it and you're ignorant. But to go and kill a water snake because you're so clueless. So she's actually a pretty wonderful water moccasin. So the person we got her from said that she was bad. And with a little bit of effort, I'm making some real good progress with her. I actually think that I can make her particularly pretty sweet. And the way I do it, once again, I give her a chance for the brain to catch up, and then I do the supportive behavior. So I'm going underneath. Nice, sweet. And this is socialization of venomous animals, because I have to think about when I first touch them, they're very tactile. So if I do something nice and positive, right there, see the brain?
Yeah.
And I just do this little stuff like that, you might think this guy's a weirdo, but I know you don't think it. You already know it. But other people that don't maybe understand snakes or whatever, I just do this, and you change this animal's behavior, because they're very much thinking and learning creatures. But see how I'm doing that with that hook, like that? And that almost looks like she kind of likes it, doesn't it?
Yep.
That's it. That's a positive thread right there.
She's not very reactive.
I don't want her reactive,
I know.
so
You
she
said
would
she was very
she would gape, sit there with her mouth open and gape
Yeah.
and stuff like that. I don't want that, because
No.
it's making her defensive.
Yeah.
So I like where she's just thinking. Is ultimately going to make a better captive animal, that is, it's going to speak well of the species, and less chances of any problems. If the animal's just biting and smashing the glass, that's traumatic for them, and it makes me traumatized. I have a Ringles cobra who's a Mr. Jerkface, and all he does is spit. He spits on the glass, so he's this type of spitting cobra, and he's just insane. But this animal's not acting like what everybody thinks water moccasins are. They don't come after you and want to get you. You know, it's interesting. When they're in the water and they're swimming, people won't be doing something, and then it starts swimming towards them. The snake isn't going, I'm coming to get you. The snake is going, I'm going over there. That's all it is. And they're like, ah, and they think it's coming after them. And it's really, really sad. So don't forget to like and subscribe, and watch us as always on Twitch. And don't forget to watch us on Friday evenings at 8 o'clock when Donny previews the video that's going to go to YouTube on our Twitch at 8 o'clock on Friday. And that way he talks about it, makes fun of me, whatever.
You show up
sometimes I show up too and say nasty things to Donny. But anyways, so I hope you guys like this. Please tell us what you're thinking. I love your commentary. I really try to go through there and glean through it. You guys are really, really nice. There's a lot of really nice things. You guys are super kind to me, and if you only knew the real me, you'd probably hate me.
Fact. I gotta turn my camera on, dude.
You didn't turn your camera on!